Stereotactic breast imaging by me, myself, Divina. So stereotactic breast imaging is a breast biopsy. It is a non-surgical alternative to surgery. This procedure is done when the complication of the breast could be seen on a mammogram but not on ultrasound. Several images can pinpoint the location of the breast abnormality, and they take samples of them afterwards. Reasons why a doctor would request this procedure is if they see a new mass, tissue change, microcalcifications, or after surgery, calcium deposition. A new mass is a tumor, a cyst, cell growth, etc. They could be cancerous or non-cancerous. Microcalcifications are just calcium deposits. This could occur due to any change in the breast tissue or mutations. Calcifications are just buildup of calcium after major trauma or age, hence a surgery. There are different types of machines for breast imaging. It is a mammography machine, but it is different due to this procedure. There are two of them. One is upright, where the patient will be seated in a chair, and there are two plates in front of them, mammogram plates, that will collapse the breast and hold it still. The tool will be in front of them, shifting at every angle of the breast to get every picture. The biopsy will also happen in front of them or on the side. But on the table, it is similar to when the patient would be basically just laying down on their stomach in a prone position. There is a hole at the center of the table where the patient will basically just lay down and place their breast inside. And on the bottom would be the tube where it would, well, the mammogram place would clasp it again, and the tube will be shifting around it, just like seen on the picture, and it would just take many pictures of the breast, and the biopsy will also happen below. A VAD, a vacuum assisted device, is what takes out the samples. And this breast biopsy device, it is thick at the handle, and it has a needle in front and then a thick handle. The needle is hollow. The reason for this is that it could take samples using negative pressure. VAD collects multiple samples that could cost up, and this device could cost up to $3,000, but for the exam itself, it is basically $17,000 entirely without insurance. This includes the entire biopsy, the lab examinations, and the supplies. When it comes to stereotactic breast imaging, a radiologist does this procedure, but they are helped by a radiologic technologist or a breast surgeon who could perform the procedure, perform the biopsy, taking out the oddities of the breast. They may prefer a radiologist who specializes in mammography. In order to be a mammography technician, you must first head into radiology and then get into a program or school that has the correct accreditation. Accreditation, an associate's degree or more. Afterwards, you could specialize in certain areas like mammography, and there are certain programs that you get into, or one from the hospital that can help you get into it more. The breast would be inside of the opening of the machine, and it would be clamped down again, and then where the pathology is, or where they believe to be where the pathology is, they will take a knife and they would make a small cut where they believe the pathology would be at, and they would basically make a fresh wound into you, and they would push in that needle, take pictures, and then they would go closer and closer, take pictures again, and then it would suck out not all of it, but many samples. This could be 3 to 7 or 12, depending on the pathology. Suck out samples, and then there you go. And then they would take out the needle and then take pictures again. And then if the radiologist believes that you will come again, then they would place a marker in there so that they could be able to find that pathology faster than before, and then they would just sew you back up or just aid to your wound again. And that's it. When it comes to stereotactic breast imaging, it is a 3D image, but in order to see where the pathology is and locate coordinates. But it also allows us for us to see the breast in 2D also. In the first image, it is before the puncture, and in the second image, it is the procedure. And these are my sources, and thank you so much for coming by.